Are you thinking about applying to dental school? Are you trying to decide whether or not you should apply right after undergrad or maybe take a gap year and do a master's program? We've got those answers coming up right now, so stay tuned. Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where you ask questions about getting into dental school, getting into residency, and life after as a new dentist. Today's episode, we're going to be talking more about dental school, getting into dental school, and more specifically, when to apply to dental school. Today, you're going to be learning some tips on when to apply and a couple of factors that will determine whether or not maybe you should apply right after right after undergrad school, or maybe take an alternative pathway for a year to maybe boost up some of your credentials and prepare for the admissions process. Today, we're going to be joined with a PreDental future student, Dr. Jessica. How you doing, Jessica?
I'm fine. How are you guys doing? How are you doing, Dr. Darwin?
I'm doing good. You liked how I said that future student, Dr. Jessica. You like that, right?
You gotta speak it into existence.
Speak it into existence. Got to make the universe know what's about to happen here. So, for those people that are listening, be sure that you tuned in on a weekly basis, as we will be posting videos like this on a weekly basis. Make sure that you subscribe and also hit the notifications, the bell notifications, so that you don't miss any of the videos. So, all right. So, Jessica, tell us a little bit about yourself.
Well, I'm currently a pre-dental student at Florida Atlantic University. I am in my junior year, but this fall semester will be my last semester as being a junior. So, I can't say I'm a rising senior. Now, as far as the GPA, it's not that great, but I do have a couple hours. I would say about 50 hours in volunteering and about 50 hours in dental shadowing. My first 2 years of undergrad, it was very shaky. I was switching my major a lot, and I was like really unsure about what I wanted to do. Until I found an interest in dentistry through a bad experience. I got one of my molars extracted, and the dentist that I had, he was terrible. It was a really bad experience. So it kind of opened my eyes on dentistry, and I started questioning myself, like, hey, I wonder what they do and, how they go about it. So I started doing more research. And then I found a dental assisting academy in Palm Beach. So I decided to sign up. And from there on, like, I fell in love with dentistry. So I started shadowing and volunteering. Where I volunteered, it was a clinic where they help serve like the population of people that are underneath the poverty level. So it's literally people that are, they can't afford dental health care, they can't afford regular health care. So
Right.
they'll go in, they're on a waiting list, and we'll treat these patients. And I work with like oral surgeons, prosthodontists, like different types of doctors come in and they do different procedures. So it's very interesting. And of course, I would attend pre-dental days from schools like UF and LECOM, and I would get a chance to talk to different admissions people and different students. And I also did attend the SNDA conference last year. It happened to be in Orlando, so I got lucky. And then
Right.
I met a lot of admissions people. I do have some admissions people that to this day I still talk to and I keep in contact with. And every time I have certain questions, I would definitely reach out to them. So that helps out a lot. But I would say right now my biggest problem is my GPA. Due to my first years being a undecided major and switching my major, and not really taking school that serious. So that's why I contacted Dr. Darwin, to go over my options and see what would be best for me in applying to dental school and making me a strong applicant.
Right, right. So, wow. Well, first of all, you have an amazing story as far as how you got interested in dentistry. Everything that you just shared is a perfect segue for your future personal statement for dental school. So that story that you shared about the bad experience to going into the dental assisting academy to all the things that you're doing now and things that you're experiencing through your shadowing and volunteering, all of that's going to be great for you with your personal statement. So you're well on your way on that part of the application. But the other parts of the application that you're talking about are important as well, which is your GPA. And one thing that you didn't mention as of yet is your DAT as
Yeah.
well. So are you a science major?
No, I'm currently a sociology major.
Mm-hmm.
And reason being, I would say one of the biggest problems that we have, especially as like pre-med students, pre-med, pre-dental, these advisors, they always like, they don't give us the best advice. So it's really tough, to pick a major and to go through it. And every time you have an idea of what you want to do, they kind of discourage you. They're like, no, you shouldn't do that. You should just do this and then get a post back. And then you're like, okay, well, what if I don't want to do a post back? What if I want to complete my prereqs within my major? Because I know you can do that. I know with professional schools, you don't necessarily need a science degree. As long as you're able to complete the prerequisites, then you should be fine. So I chose sociology because I like it. But originally, I I was supposed to do biological sciences, but it didn't really interest me as much. And being from like my experience of having like a bad dentist, I wanted to kind of, learn about um, things that happen within the healthcare, especially to us minorities. So I can take a different approach when I do become a dentist. So I don't ever have to, I don't ever give a patient that bad experience that I received,
Right,
especially being a minority. And I know there's a lot of disparities that happen within the healthcare for minorities.
right,
So that's another reason why I chose that major. But like I said, I've been having a lot of difficulties. I had a pre-professional advisor. She's like, yeah, just finish your bachelor's in sociology and just come back for 2 years and do a post back. And I'm just like, well, can I not just finish my prereqs now? And she's like trying to advise me not to. So it's it's just very difficult right now. But I
right.
can say what I've decided to do. I decided that I'm going to try to finish as much as prereqs as I can. So by the time I do graduate, I'll probably end up having like 2 to 3 classes left um, to just pay out of pocket and finish, rather
Got
than
you.
go into a post-bac program and pay all that money.
Gotcha, gotcha. Well, just listening to you, a couple of things come to mind. Um, Three options or three things that I would strongly want you to consider. Number one, your GPA. How many more hours do you have to your sociology major?
Um, um, just my sociology. Well, sociology, you have to take 30 credits, and then the rest of the credits that you have are like pretty much free electives. So I would say I probably have maybe 2 more semesters left, and then I should be complete with my sociology credentials.
Two, two more semesters of sociology. How many um, hours for those 2 semesters as it relates to just the classes for for your major?
Let me see. I want to say about 12 more credits.
12 more
If
credits. So
12 around that area.
is that 6 in the fall and 6 in the spring
No, like 12, 12, 12 to 16 credits altogether.
for the
So,
semester?
right. So each of the classes are 3 credits.
Okay.
Yeah, so it's around that.
So how many of those hours will be dedicated to sociology?
Oh, you mean how many credits do I have left altogether to? Oh, okay. Um, I know right now, just off the top of my head, I know I have 72 credits completed. A bachelor's is 120.
Okay.
So for sociology, I'm almost finished. I would say about 12 to 16 credits, I believe that,
Okay.
yeah. And then I've taken Chem 1 and Bio 2. And then for this fall semester, I'm taking Bio 2 and Chem 2.
Okay.
I know that.
Okay. And then you'll be starting your senior year next spring.
Correct. Yes.
And then you'll be taking some other prerequisites for dental school as well, doing your
Yes.
senior year and I guess maybe the summer.
Yes. So the spring and the summer, and also that fall.
That fall. So fall 2020, you'll
2020.
be finishing up your
Bachelor's degree.
your
Yes.
bachelor's degree. Okay. Um, got you. So you really won't be starting. You really won't be applying to the cycle for dental school until 2021, really.
Correct.
Okay. So here's the deal. So the thing is, you've got one, two, three, maybe 4 semesters to really see how you can boost your GPA. Is your GPA above or below a 3.0 currently?
It's below 3.0.
Okay. So, there's with you being going in finishing up halfway through your junior year, it's not a lot of time to see how you can boost up that GPA, and you may not see a significant change between now and the next 4 semesters, depending on the number of credit hours that you're taking, but more specifically, the grades that you get in some of those classes that have, maybe 3 or 4 or even 5 credit hours, so to speak. So um, that's kind of like a little numbers game that you are gonna have to figure out how to play to boost up your GPA. Um, that's the first thing. So if it's below a 3.0, there's some other things that you're going to have to probably immediately concentrate on. Number one, like I said, trying to figure out how you can boost up your GPA with some A's and some B's on some of these classes these next 4 semesters. Um, a post-bac program is another option. What's nice about the post-bac program is it allows you to take courses and get grades that will directly affect your undergraduate GPA, right?
Mm-hmm.
And that's the difference between that and a master's program. Master's program will not go towards your current GPA. Only
Okay.
the post-bac will. Okay. Um, if for some reason by 2021, when you're finishing up, your GPA is still below a 3 or maybe not where you want it to be, that's probably going to be the indication for you to strongly consider doing a master's program. A
Okay.
master's program in like biological sciences. You're in Florida right now, correct?
Yes.
There's a great program. I have a lot of pre-dental students that are considering it, and some current second and third year dental students, mentees that have done this program at Barry University.
I'm well familiar with that.
Well familiar with it. Great. It's an excellent program for both those students that are looking to pursue careers in dental school or even medical school. And I know there's a couple schools that pretty much almost automatically take students from the Barry University program right on into dental school. It's that intensive, it's that good, and it's that structured to the point where it's going to adequately prepare you um, a lot better if for some reason you needed to be a little bit more prepared for your application. So um, those are the two things that I would recommend immediately.
Okay.
All right, immediately. Um, and then at some point, the other thing that you really have to concentrate on that's going to help you get into dental school, of course, is your DAT.
Mm-hmm.
DAT. GPA, DAT. Those are one of or two of maybe 3 or 4 or 5, 6 other important factors that really are considered into this whole entire process. Um, you've got your shadowing hours, you've got your volunteer hours that are great. That's fine, but um, there's probably a little bit more emphasis on the GPA and the DAT. So, and you kind of have to attack them one at a time. It's going to be very difficult trying to do both of them at the same time. I would recommend that you probably focus more on the GPA slash master's program first, and then while you're in your master's program, if you decide to go make that route, uh, that's when you start going into preparing for your DAT. And I would prepare for it based on um, doing a prep course.
Okay.
There's many of them out there. Crack the DAT boot camp, Kaplan, Princeton Review, etc. What's nice about those programs is that, and those courses, that it really prepares you on how to take the exam, because you haven't taken the DAT before, have you?
No, I haven't.
Yeah. So you're not familiar with the exam. So when you're in that master's program, or when you get to the step of preparing for the DAT, one of your main jobs is going to be you becoming an expert in the DAT. That means you have to be familiar with all the sections, how they ask the questions, et cetera, et cetera, et cetera. So only way that you can really jumpstart that process is really being able to do that is via a prep course. And like, again, I've got some recommendations based on some mentees. Some of them have used one course by itself. Others have used different components of other courses, and they felt that prepared them as well. So um, that's that's pretty much what I kind of foresee for you based on your situation. And it looks like your cycle will be maybe at the earliest, maybe 2021. If you take
Okay.
if you take that master's program, it may be 2022.
Okay.
But that's okay. I mean, that's the thing. You want to be able to prepare yourself the best way, so that maybe you're very fortunate to be able to just apply to dental school once.
One time, right? Because the application process, based on what I heard, is very expensive, and it's funny because
It's a process, and
yeah.
it's timely and it's costly. It's just like any other investment in yourself. So
Her name
again,
is Shayla.
Shayla, okay.
Yeah.
So with any process, you want to make sure that you are pr- adequately prepared for the process. So if you can take one swing at it and knock it out the park, and have 5, 6 different schools that you are getting acceptances from, and being able to choose from one. So, but if you kind of go back and reverse engineer, that means you've got to be prepared for the steps to get you there, which is a great DAT score, and
Mhm.
also a great application, which includes GPA, which includes possibly doing a master's program, which includes your personal statement, your CV, being prepared for interviews. All of that is all part of that process. But with you, it sounds like what's going to be key is the GPA these next 4 semesters, and reassessing where you are. All right. And then next, based on that assessment, strongly considering, if you need to, doing a master's program, which is one of the best ones that's right there in your backyard,
Mm-hmm.
and using that year to really continue to sharpen your science skills and your aptitude, which it's also going to be able to do is really get you give you a little jump start as to the pace as to how dental school is going to be as well.
Mm-hmm.
And then use that time, that 1 year in your master's, to help you transition into applying to dental school and also taking the DAT. I think that's going to probably be the best route for you based on the feedback that you've given.
Okay. Sounds good.
Sounds good. Was that helpful?
Yes, it was.
Awesome. Awesome. So guys, if you guys are listening, if this has been helpful for you, put down here in the comments, what did you like best? The question of the day is, what did you like best about what you've learned, about some tips and advice that we've shared with future student Dr. Jessica? Put those comments down here. And also feel free to always send me, if you have some topics, other things that you want us to talk about, send me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. All right, future student Dr. Jessica Lewis. I hope this has been helpful. We'll talk to you soon, okay?
We will. Thank you so much.
You're welcome so much. And guys, check out this next video right here about getting into dental school. That hopefully this is helpful as well. And we'll see you on the next video. Thanks.